finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hey everybody, welcome back. This week we have an amazing episode and something really unique for you. We are interviewing one of the founders and CEO of CabinetHealth.com. You'll be really interested in this. I found it totally fascinating. Cabinet is the world's first fully compostable medicine system and offers direct-to-consumer marketing and OTC medications. So we are super excited to share that journey and interview with you. But before we dive in, our sponsor for today is Vive Funds. Vive Funds is a commercially multi-family real estate firm trusted by physician investors, physician families, and busy entrepreneurs from all over the U.S. Located in Dallas, Texas, and founded by Veena Jetty, Vive Funds specializes in curating conservative, passive real estate investment opportunities for investors. Veena brings a dynamic perspective to targeting, acquiring, managing, and operating investment assets using the best time-tested practices combined with cutting-edge technologies. Reach out to Veena and her team at Vive Funds to find out how you can be a successful investor too by creating opportunities for you to build your portfolio. You can find them at drpodcastnetwork.com/Vive Funds. Again, that's drpodcastnetwork.com/Vive Funds, VIVE funds. And I'll link that in the show notes. So how many times have you wandered up and down the aisles in the drugstore or the supermarket trying to figure out what to get for your headache, upset stomach, allergies, and wondering generic, name brand? I mean, it's like so confusing for anybody. Along with that, the endless packages, bottles of stuff, or, in the middle of a pandemic when you can't get any hand sanitizer, Tylenol, or Pepto-Bismol. What do? Well, welcome to a unique, one-of-a-kind system called Cabinet, where they actually have online direct-to-consumer products where you can go online with the click of a button and get not only headache medicine, allergy medicine that is completely free of toxins, gluten products, but also tried, true, tested to make sure that the medication is consistent, and also in compostable material so that we're not wasting all these plastic bottles.
And it looks great too. It's not like you're getting something in a compostable package that looks like it's been put into a paper envelope or something. It actually looks really cool. It's easy to stack in your medicine cabinet, thus the name Cabinet. And actually, this was really quite an interesting discussion that we've had. I think you guys will really enjoy it.
Yeah, so today we are talking with Achal Patel, the co-founder of the company, and stay tuned because it's a great journey. So welcome. Today's, I mentioned, we have a special guest with us, one of the founder of Cabinet, and today we have Achal Patel here. And welcome to the show. So excited to have you and hear what you're doing with the online presence with Cabinet and the digital marketing of pharmaceuticals.
Thanks for having me. Looking forward to the conversation.
So why don't you give our listeners a little bit of background about yourself, your partner, and the company and how it originated?
Absolutely. So I'm Achal, co-founder, CEO at Cabinet Health. And my personal background is I grew up in a family of healthcare entrepreneurs and healers, I'd call it. So my entry point to the world of medicine and care was very personal. 55 years ago, my grandfather built a acetaminophen factory from the ground up in India. the active ingredient in Tylenol, Dayquil, a number of other pain relievers that we take for our most common symptoms. At a really young age, learned a lot about that industry. I spent childhood summers in an over-the-counter medicine factory. And for me, that was family. It's not the kind of scary, dark labs that we see depictions of online or on TV, but rather as grandpa's factory. And what I learned at a really young age was to remember that in the world of medicine, we should put first and foremost the fact that we're trying to help people live healthier, happier lives. And what that led to in my family was this legacy and lineage of folks in healthcare up and down the value chain. So while our family's kind of entry point was in the world of over-the-counter medicine manufacturing, what's trickled down is I have aunts and uncles in the pharma space. Both my parents are physicians in a small town in Virginia. A brother works at a big healthcare system. And my family dinner tables growing up were effectively board meetings, for better or worse. And I learned a ton about the world of healthcare and saw this giant, open, forgotten world in over-the-counter medicine. That's really where some of the initial thoughts behind building Cabinet started. And along that kind of personal journey, at my very first job out of college, I met my co-founder, Russ. Russ and I kind of hit it off from our first interaction, and we had the opportunity for 6-7 years to build what was one of the first social innovation arms of Deloitte Consulting. Deloitte Consulting is a large company that supports Fortune 500 clients as well as the government in helping optimize core business strategy, kind of you name it. And Russ and I were really entrusted with an opportunity to think about how do we take the advice we're giving to those large corporations, the government itself, and think about how to build social and environmental good into the core business models that we're recommending for clients. And we spent the better part of 6-7 years doing that and came to fore a few years ago thinking about how do we connect my personal lineage in over-the-counter medicine manufacturing with really what we had trained on, which is how do you build purpose-driven brands? How do you build sustainable business practices into the core of a company in a way that's good for society, good for customers, but also profitable? And set off to build what was the underpinnings of Cabinet. And for us, as we think about what we're building at Cabinet, the way we look at the market is that our environment around us and our physical health is inextricably linked. And yet there are no sustainable options in healthcare. Our ambition at Cabinet is how do we build the world's most sustainable healthcare company, starting with over-the-counter medicine. For us, what that means is providing consumers with a choice to buy more environmentally sustainable products, to buy products that are high quality for themselves and their family, and buy products that are actually personalized around their needs versus having to sift through 100 plus brands in an average retail pharmacy. That's really our ambition at Cabinet. That's how I got into this world and how I met my co-founder, Russ, and excited to unpack that a little bit more in the next few hours.
So if I were a patient with a headache or with, abdominal bloating or something, how would I interact with your company?
So today we sell Cabinet in a few different channels, primarily through our own website, cabinethealth.com. If you're a patient who has a headache, come to our site, look for the category of products that are right for you. For some folks, that might be going through a selection of pain medicines and a guided experience to pick the right one for you. For others, it might just be grabbing a kit because you already make enough decisions in a day and you just want something to make your headache go away. And we ship that to your door in a couple days. In addition to selling on our own site, we're in the process of expanding some of our retail and B2B footprint. So over the course of the next year and a half, listeners will have an opportunity to actually see Cabinet products in fully compostable, sustainable packaging on retail shelves, hopefully at a pharmacy near them.
So what is the difference in the medication? You're talking about, the sustainability, which is the, compostable, packaging, which seems like kind of a no-brainer when you think of how many gazillion little plastic bottles we throw away. And then what's the difference in the actual medications as far as, because, the generic world is all over the map. And, I started to believe patients after a while when they said this certain brand of generic, the blue one doesn't work as well as the white one. And eventually you figured out, because they're not all exactly the same. So what makes cabinet medications different?
We have this saying that not all generics are created equal, and it's something that we've certainly learned more and more with a deep understanding of the supply chain in this space. And what I mean by that is that your average medicine cabinet probably has 15 to 30 different manufacturers involved to get to the products to you that you take for everyday symptoms like a headache or allergies or others. And the manufacturing that puts those products together is exceptionally global and exceptionally fragmented. And what that's created is a really difficult environment for the regulation of quality. We have processes in place to make sure the manufacturers that we work with are the highest quality. But when you're producing millions and millions of products every single month, if I'm talking about the larger OTC medicine industry, it's really hard to understand at the bottle level, at the batch level, is the product that you're taking free of carcinogens, free of toxic metals? Does it actually have the dosage form that it's supposed to, the active ingredient? And are there any other allergens in there that might actually impact how it interacts with your body? And as we thought about how do we actually provide fundamentally just transparency for consumers around knowing what they're putting in their bodies, what we've implemented at Cabinet is what we call batch level quality testing. What that means is that in addition to the quality assurance that we do for our factories, for putting medicine into bottles, every single batch of Cabinet before it's packaged into our bottles is tested by a third-party Yale outside of the third-party lab outside of the Yale Research Center for the dosage form and its active ingredients to ensure that the medicine actually has what it's supposed to have in it, to ensure that the product is free of carcinogens and other toxic metals such as mercury or lead, things that can oftentimes naturally actually come into products just if they're grown in the ground. And it also is tested for, at the moment, gluten, as well as a couple other allergens that are really important for our consumers. And so as we think about our point of view on quality in the market, it's how do we just provide transparency to our customers so they know that the medicine they're taking is actually what it's stated to be on the label, and it actually does not have any ingredients in it that can negatively impact them while they're trying to take something to make them feel better.
I was going to say that's, something that I think a lot of people, even myself, don't really think a lot. I know the one thing that happens a lot with patients is they come in and the first thing, because I'm also gluten intolerant, is some prescription medications, the capsule, the carrier basically has gluten. And so that's always a concern. And I'm like, oh yeah, I never thought of that. But I think a lot of people just go into their local big box pharmacy or even grocery store, grab name brand or generic because it's cheaper of their acetaminophen or ibuprofen or their antacid, and don't even really think about quality control. I mean, I guess people take it for granted, or even the fact, you think carcinogens and lead. I mean, even myself is going, you don't even really think of those kind of things being an issue. You just assume it's all good because it's in the USA and it's all going to be the same. So that talking about that even just raises the whole thing of, wow, people aren't really aware of those kind of things being an issue. That's what I'm thinking.
Well, and it's a major issue. I met a guy who was, he came in with his wife and he was like, we've been living in, I don't know where it was. They were living in China or India or someplace. And I said, what's your job? And he goes, well, I work for the FDA. And I'm like, what do you do? Well, I'm the quality control chemist for everything that is export quality, pharma from factory X or Y. And I said, well, what do you mean? He goes, well, I would never take any domestically export, a drug that was made for domestic use in any of these countries ever in my life, because you will have absolutely no idea what's in them. And I was just stunned. I mean, he's looking at me like I'm some kind of, moron for not understanding that. And he's like, no. And so it's like, we have all these patients because we live on the West Coast that, they walk down, they go on a cruise ship to Mexico and they just load up on Valium and whatever else you can get. And it's like, who knows what's in there,
Oh, no kidding. buying like from antibiotics to Retin-A to Valium. Exactly. So no, I really, that raises a good point when you're marketing and putting that out there, as well as now that there's so much, especially with the gluten sensitivity factor, that this is really well quality control, because I know that people are aware of it with the vitamin world, but we don't tend to think of it with over-the-counter things like antacids to pain medications. So can you share a little bit more exactly what your product line is, and is it going to be expanding? Is it going to be including any prescription medications, nutraceuticals, anything like that?
Absolutely. So really, as we talk to our customers, really the central reason they come to Cabinet is to feel better, whether it's because they have allergies or a cough or a stomach issue or just having issues sleeping. When we talk to our customers, it's really like, how can you just help me in sickness and in health? And as we think about that, there's a way to approach products for us that I think is a little bit broader than just looking at the individual molecule level. So for listeners, really tangibly, today we sell 30 over-the-counter medicines that are the equivalents of the biggest brand names that many of you are aware of, the allergy medicines, the cough and cold, the pain relievers. But our view on care and product portfolio is very much a spectrum. We have consumers who have a headache, they need something immediately, and they want an over-the-counter medicine to resolve that headache. Today, really, as we think of that spectrum, Cabinet serves that across allergies, cough and cold, pain relief, sleep, and digestive health. But as we think about building out our product portfolio, on one side of the spectrum, there's also a subset of consumers who really care about health creation. How do I make sure that I don't actually need this medicine? Or if my allergies today aren't as bad as some of my worst days, is there something that's a little less strong than an over-the-counter medicine that I can take? And for us, there's a very clear process to think about what are the non-OTC and non-prescription options that can support alleviating headaches or alleviating allergies. For us, it's really important that anything that we bring to market in that space is clinically verified, that our advisory team and clinical team actually has clear indications that they are able to support alleviating symptoms. And so as we think about where we go in the future, it's a portfolio of products that support each of those conditions in a non-OTC, non-prescription format. And then on the other end of the spectrum, we do have customers who come to us for their OTCs, and it's a very natural question of, I'm getting my prescription filled at my local pharmacy. I want to have it in more sustainable packaging. Can I get this from Cabinet? And so for us, being able to serve that consumer is really important, but doing so in a way that is in line with our values as a sustainable healthcare company is critical. And so as we think about our portfolio, we do want to move into prescriptions in the future. But fundamentally, why customers come to us is because we can offer them the most sustainable option in medicine. And we need to make sure we can stay true to that, even as we move into the world of prescriptions. And so really our fun R&D efforts at this point are thinking through, how do we get through the right regulatory hurdles that allow us to commercialize our packaging, which is as shelf stable as plastic, but as compostable as a banana peel, for not just over-the-counter medicine, but also for prescriptions. And so in the next year, one of our core focuses is, how do we continue to share that lab data with the FDA, with other folks required to be able to bring to market sustainable options, not just for OTCs, but in the world of prescriptions, where the pain point of plastic waste is even greater, frankly, than OTC medicine.
So does the consumer pay a premium for that sustainability?
It's a great question. So today, if you were to look at our products, they're around the same price as the name brand for a sustainable option. If you buy a kit from us, it's around 20 to 30% less. And so our positioning today is the most sustainable option you can buy in medicine, batch level quality tested, and a little bit less than the name brand. My ambition is that over time, we're able to serve enough consumers with this product that we're actually able to bring it down to the same price or less than the generic equivalents as well. And this is very typical, kind of tip of the iceberg when it comes to new product innovation of entering the market. Building sustainable packaging definitely has fairly high R&D inputs and it has fairly high cost. But as we think of our broader ambition over the next 5, 10, 15 years, it's that we don't want to just serve a subset of the consumer audience that can pay a premium to have a sustainable option, but rather how do we actually move the industry? How do we move the supply chains to make this the status quo versus a plastic single-use bottle? And so today, the price point, very transparently, is more expensive than some generic options. But our ambition is over time we make it the same.
Right, and you're convincing me, which I'm the crusty conservatarian, rural, multi-firearm owning guy. And the thing is the sweet spot from a marketing perspective in there, your differential competitive advantage is, if I can buy a piece of plastic versus buying, a compostable package, and it's the same price, well, then it's a no-brainer. I mean, and that's the thing. You're going to get my daughter right now because she has to buy, she buys everything with the little rabbit on it, the cruelty-free, whatever. She gave us all these products because she figured out, she has this pet rabbit and that they tested it on rabbits. And I said, I want extra cruelty products just to be obnoxious because that's my love language. But, it's fascinating because, so you can start the marketing there with the people that are like, yeah, well, that makes perfect sense. I'll pay 5% more or 10% more because it aligns with my values. But the sweet spot's going to be when it's a no-brainer, right? I mean, it's kind of like, I bitched my brains out when they got rid of incandescent bulbs because, you had to buy CFLs, which were horrible. And if they broke, I mean, you needed to hazmat suit to throw the damn thing out. But now what do we have? Now we have LEDs, which consume a fraction of the power. They last literally 100 times longer, and the light's better, and they don't make heat. I mean, it's a no-brainer. Like, I don't care, where you are, in the environmental world or political world, it's a no-brainer. You're going to use LEDs. I mean, I pull them out of all, my motorcycles. I pull everything out and put LEDs in. It's the greatest technology ever. I mean, and I would envision this, like that would be the goal. Like everything should be packaged this way, especially something like medications where you're throwing bottles out like almost on a continuous basis.
Yeah, absolutely. The latest number that we've seen is there are about 195 billion single-use bottles of plastic produced by the pharmaceutical industry every year.
Wow. Almost you'd think that they would even be able to come up with a way, like in the old days when you had your milk jug and the milkman came around and could refill it, like you could go back into the pharmacy with your stupid plastic bottle, hand it to them, and they could just fill it up for you. I mean, I don't even know why they haven't started off with something like that, reusing what you already have, but...
No.
What?
No, because I used to do vasectomies in my family practice. And I got a semen analysis sample in an old pill bottle. So we are not reusing them.
Hey, that's on them, I guess, if they want to consume.
Didn't expect to hear that one
today. You never know what's going to come out of Tim's mouth in these interviews. Truth.
Well, it's the truth.
This is truth. It's total truth. Is there what appeals to, I think should appeal to Tim, the crusty person that maybe isn't into the environment, is just the fact that you're getting some medicine that what the quality is, it's reliable, it's not a bunch of filler. I mean, even that is a great starting point for a sales pitch for you, which I love.
You mean it's not the chicken McNuggets of Tylenol?
Yeah, stop it. So my I guess next question is there a delivery point that someone can expect? Because everybody likes to go to Amazon and hit the button, and if you live in the big city, the little drone flies over and drops your package off. How are you? You said you're delivering them through the mail. Usually, it's a couple of days. How do they arrive by? Just regular mail, or FedEx, or UPS, or how does that work?
Yeah, it's a great question. Right now, we do the majority of our sales online, and so there's some realities where the consumers that we serve tend to be proactive, or they tend to be more chronic users that are aware they're going to need a medicine ahead of time. And so it very much is that bucket of proactive consumers who are already buying online, and you get your products over the course of a couple days. Longer term, to really serve the broader over the counter medicine market, even even as COVID has subsided a bit, we still see about 75% of OTC medicine sales in store. And so as we think about where cabinet goes in the next few years, to really achieve our ambition to replace plastic in pharmaceuticals, we need to serve the customers who, when they have a headache, they go to the store, and we need to be on the shelf there for them. And while today e-commerce has been a great way for us to enter the market, to learn from consumers really quickly, and it's actually been the inputs needed to help us understand we need to make investments in sustainability and quality. Longer term, we need to serve that reactive customer, whether that's through more traditional retail, just being at your pharmacy or your local big box retailer when you need us, or through more clever delivery models, whether that's kiosk or rapid delivery. And we're very open to all of those and are starting to build inroads to be able to serve that reactive customer. Because I know myself, even as someone who runs an over-the-counter medicine company, oftentimes I've found that I have allergies and I don't even have my medicine with me. And so we're all human, and we need to serve that human need.
No, exactly. When you say kiosks and so forth, just think of Proactive, which is the, acne medicine. You literally can go get it in like a big mall, and they have, just like a candy machine. Or a soda pop dispenser, you put in your card and get your whatever you want.
I'm envisioning converting all the cigarette machines that used to be in bars.
No kidding. There you go.
To, hangover medicine and, whatnot.
But I love it because there's so many innovative ways, like you said, that you can reach the consumer. And for people that are just kind of as a PRN as needed, that just having that accessibility, whether it's in the bigger stores or kiosks, or, you're traveling, you want it at the airport, would be amazing.
Can we talk a little about the business side of this? I think you've knocked a lot of my crusts off as far as why I should, use Cabinet. What was the genesis, of the company? Like, how did you start funding? Obviously, we heard a little bit of how you came up with the concept of it, but how did you go from 0 to 5 miles an hour, and then from there? Because I think a lot of our listeners would be really interested in that.
Absolutely. So, fundamentally for us, this started with Russ and I thinking about how do we just test this market. What we had initially seen 3-4 years ago was that the world of over-the-counter medicine hadn't fundamentally evolved in decades. There are 100 plus brands in an average pharmacy. If you go on CVS.com, there are probably 2,000 to 3,000 over-the-counter options available. And we just spent a lot of time in pharmacies talking to people navigating the aisles, and corroborated that it was as confusing for them as it was for me. And I have the advantage of having a mother as a physician as well. And so I think for us, that just indicated there's a smarter way to buy these products. And we initially just started by putting labels on 7 of the most common OTC medicines, putting them on our website, and starting to drive marketing to it. And really early and really quickly, we saw that the messaging of, we're trying to build a better over-the-counter medicine experience really was resonant with consumers. At the time, and frankly still, we have a lot of work left to do. But what's been really encouraging is that people are excited to be on that journey with us. They're excited to think about, how do we build one brand that has everything that I need? How do we build one brand that is sustainable and one that is representative of quality? And so the early days for us at Cabinet were thinking about, this would have been early 2018, just piloting a few products, and customers were buying them. And I think that was a bit of a surprise as a first-time entrepreneur for me and Russ, and really exciting. It's just like, oh, we created this brand out of nowhere, and people are now buying it and putting it in their bodies. And I think there's no greater like vote of confidence than some random person on the internet like giving you their money for a product that they're taking to improve their health. And so from there, it really just turned into talking to every single one of those people who purchased from us, asking them, what resonated with you? Why did you buy from us? What can we do to make this better? And that was the stepping stones for us to get from those initial couple sales to dozens to a few hundred a day. And we were funding the business 100% just through those sales for the better part of a year. As the business continued to grow, we decided to make kind of greater investments in how do we build out the product portfolio? How do we make the brand that we want that represents our longer term ambition? And, as any first time entrepreneur does, we started to learn how to raise capital. And for us, that was just literally going from dining room to dining room of friends to initially get some investment to support our ambition. As that kind of continued to grow, we're now talking about the late part of 2019. The business really started to continue to grow and take off. And then by early last year, as we all know, the COVID pandemic came around the corner and was a huge tailwind to e-commerce, and even more obviously so to buying over-the-counter medicine and health essentials online. And alongside that, we experienced this rapid phase of growth that, frankly, we were just duct taping our business together for 6 months trying to hold on. And I think what pushed us through was just the number of conversations we had with customers who were like, I'm trying to buy acetaminophen or hand sanitizer for my mom or my grandma in Florida, trying to buy something and ship it to them. I can't get to them. And these moments of frustration that I think were very unifying for all of us, that we were able to serve a little part of. And I think where that kind of really influenced our business was remembering that there's an opportunity well beyond just over-the-counter medicine for us. And, learning that one of our key differentiators is that a customer can pick up a phone or email us and get a response. I don't know the last time you talked to your favorite over-the-counter medicine brand, but for most of our customers, they've never interacted with the medicine companies they've taken. And so that was a huge learning for us. And really kind of to close this out, where we are in our journey is, we had early days of learning, growing and selling a few products online, expanding that portfolio, and then experiencing rapid growth over the last year with the tailwinds of our public health environment. And now what we're really doing this summer is how do we just hit the reset button, get our supply chain and infrastructure and team in a good spot to really gear up for the relaunch of what we're calling Cabinet 2.0. So this fall, our entire portfolio is moving into refillable, compostable packaging system that I've talked through. We're rebuilding our entire website to be more care-centric and be able to educate consumers better around the products that they're taking. And then by the end of the year, we'll be launching in new distribution channels, really simply put, into physical pharmacies as well, to continue to support patients wherever they are.
So do you, are you still taking investors? Do you have a investors relation, tab on your website, that kind of thing, if people are interested in being part of this?
So we've done a number of private investments over the course of the last couple of years. But what I would share that we're really excited about is, as we've built this brand, as we've built this company, we found physicians, pharmacists, nurses, our customers have actually very much indicated they want to be interested in not just being along for the journey, but actually, investing in us, supporting us as a business, which I think is, still exceptionally flattering and remarkable for me. And to be able to actually do that in a way that's structured and thoughtful, in about a month, in August 15th, we're launching a crowd equity campaign on a website called Republic. And what that really simply means is we're giving our customers, our physician believers, our pharmacist believers, an opportunity to invest in Cabinet in increments as small as $250. And so for us, why that's really exciting is that traditional investment in startups and private companies has required a lot of capital, a lot of connections. Even getting a seat at the table is exceptionally difficult. And for Russ and I as founders, that's just contrary to the way that we want to build our business. And if we have customers who've been supporting us from that first test that we did years ago, all the way through whatever we become in the next decade. We want them to have upside in our business as well. And so to your question, in about a month, August 15th, we're launching a crowd equity campaign on Republic, and would love to share that link with you as well.
Yeah, for sure. I'm getting a theme here, which I'm really liking, which is, I read this in one of Oz Guinness's books, and Oz is a amazing Christian apologist, and in the section on capitalism, he talks about how capitalism worked, because he grew up in Mao's China and actually lost 2 siblings to starvation through that whole purge that went on in China. So he's really sensitive to this, and he goes, capitalism has driven more people out of poverty, raised standard of living, built wealth, but it only works if there's an ethic bigger than itself guiding it. And I think that that's absolutely true. And we've seen this with, giant multinational corporations, and how, they can get so much power. They have more power than lots of individual countries now, and if the only goal is money, eventually you end up, with slave labor and just horrible, horrible things that have happened through, antiquity. And it's really fascinating to hear sort of the value-driven side of that. Whether or not my values entirely mesh with yours actually doesn't really matter to me, because as long as they're not contrary to mine, I know that you actually have something bigger than the bottom line guiding your company, which is a massive deal. When you look at, I'll give an example of, Bayer. You watch a TV ad and it's Bayer, trust the, aspirin company. It's going to save your life. Well, Bayer also brought us heroin. Bayer was part of a consortium in Germany that built Zyklon B. Not exactly, high moral standards. And so, not that the company is necessarily bad now. I don't know anything about it in particular, but you see, you can see what happens. And it's so important that the values are what guide the company. You got to be profitable. But you know what? If you're really guided by that passion and that value, and you bring a good product, you will be profitable. It will take care of itself. I've seen that time and again.
Absolutely. And this is something that is really interesting to me, because I shared some of Russ and I's personal backgrounds of helping businesses think about how do you ingrain social and environmental good into your core business model. And oftentimes the way we build those business cases to compel people to do that is that whether you want to or not, your consumers will vote with their wallet. For example, the world of sustainable brands. In the last 5 years, sustainable brands and consumer products have led the majority of market growth, despite just being a sliver of market share. And there's no clearer manifestation of why that is important for brands than the fact that they're being outcompeted by companies that are sustainable, that are writing their values on their products, that have the bunny rabbit on the makeup container. And I think business leaders are starting to react to that. They're seeing that, whether it's intrinsic and it's something that's core to who they are and that they want to do it or not. Fundamentally, I think the outcome is the same, which is that people are being cognizant that consumers want to buy from brands that represent their values, that actually aren't negatively impacting the world that they live in. And I think beyond just consumers, the second part of this too is around team and employees. So for us, one of our greatest assets of being values driven is that we've been able to attract world-class talent that at a company of our size, we wouldn't typically be able to if we didn't have that mission orientation. When you have an option to work at anywhere you want in the world because you're exceptionally talented, not speaking about myself, talking about some of our team members, the ultimate differentiator is like, are you going to be proud of what you build 5 years from now or 10 years from now? Like when you have children, are you going to tell them that you are building something that was improving the world they live in or negatively impacting it? And I think there are many ways to cut this. And, for me personally, I find purpose in building a values-driven business for my own reasons, and everyone has theirs. But even as a CEO, like fundamentally, we can't be successful to attract, acquire, and retain customers. And we can't be successful attracting, retaining, and keeping really productive employees without having a core mission that benefits society.
No, it's fascinating. I hearken back to the conversation, at least legend has it, of when, I forget his name, the former CEO of Apple was leaving Apple for Pepsi, and Steve Jobs said, "Do you want to make sugared water, or do you want to change the world?" And then he came back to Apple. I mean, it's just, and that's exactly right. I mean, people really want to live for something bigger than themselves. And, it's interesting because even in big corporations, when they get pushed in these directions and it's not necessarily their core values, it still matters. I mean, you can get a salad at McDonald's because the market demanded that. Now, it might not be the greatest salad, but it's not a Big Mac.
Hey, so I like touching on the personal side of things, and I want to hear just a little bit more, and I think our listeners would find it fascinating too. I mean, for Tim and I, because we're both physicians and raised our kids in a dual physician household, our kids kind of got used to the convenience of having parents kind of just give them unsolicited advice, which has scarred their brains a little bit, but also doctoring them when needed, the whole convenience factor of that, which they just take for granted. So when we were talking before we were recording, both of your parents are physicians, and you also have, was it your grandfather that has this manufacturing plant of pharmaceutical? I mean, that in itself is crazy. So can you just touch on a little bit, like going back to childhood, what was it like to even be like around the pharmaceutical manufacturing industry, your parents' influence, and how you think that has really impacted and shaped where you're at now?
It's a great question. And I think the bizarre part of this is over the years and decades, I've grown more cognizant of how unusual this is. For me, growing up, it was very much just what I knew to be the norm of if I have questions or if I have a headache, I'm literally going to be taking medicine that my family's manufactured. And if I have questions about allergies or a stomach ache, I'd go to my mother, who's a pulmonologist, or even as I, had questions about like heart conditions, go to my dad, who's a cardiologist. And there's, I think the learning for me along that was that there's really no replacing that care and like accessibility of care in a way that I think is scalable for consumers, and hadn't been until more recently when we have digital tools to do that. But I think the lessons for me is that having that care is such a critical part of like the healthcare system. Access to a physician that understands you, that is able to even answer your basic questions, and something that I've always held to be really important is how do we figure out ways as a business to emulate the care that I get from my parents, even to this day, for all of our customers. I think it's a really tall order and a tall task, and we certainly have not accomplished it yet. But in the long run, like how does every cabinet customer feel like their mom or their dad or whoever they trust to take care of them is there for them, but also in a physician capacity or nurse capacity or pharmacist capacity. And so I think the takeaway for me is just that oftentimes we think about healthcare in these like really complicated structures, especially in the US, of how do we rebuild the insurance system? How do we rebuild prescription delivery? How do we rebuild the way that we even have our interactions with our physicians? Where at the end of the day, like a simple text or a phone call with someone who you trust and someone who can provide you with like guidance when you just have a headache and want to make sure all you need is acetaminophen or ibuprofen and not something else, is as important to our healthcare system and care as I think all of the complexities of infrastructure and regulation that we often think about. And so takeaway there for us is, remembering care is very human. And sometimes like we just need to talk to someone that is going to have our back.
Yeah. I mean, you said it so eloquently because, lately I've been doing a lot of telemedicine where we were working. And sometimes the older I get, the more almost removed I get from that and forget, some things that I just take for granted as a physician, that people would know simple little things. And so we get these telehealths or people are calling what I think is like, this is just seems so dumb. Why are they calling and asking about some simple little thing about some itch or scratch? I mean, just go to the cabinet and put some Benadryl or hydrocortisone on it. And then as I get to my visit with these people, and there's the personal side of it, and they're, we're having fun, and I can just reassure them. And that's mostly what they want, is reassurance, and, give them my expert opinion as well. But it's something that I guess the older I get, I start to forget that a lot of people, I mean, they're intelligent. They just want some reassurance in their medicine. They want that human interaction. They want to feel like, yeah, it's their sister, or their parent, or their best friend that has this medical advice. And that's what a lot of people want. So I really get where you're going with that, and being able to have a company that shares that and has that value and passes that on to the consumers is huge. And so I'm just saying that even as the doctor, sometimes I forget that it's just too easy I can interact with my kids, and they get the mom and dad as the doctor. It's so easy, but that's what patients and customers want in their experiences as well. So I love it. So I'm super excited to share the links for the investing that's coming out, your website. Is there anything else that we haven't touched on in the whole story and history of Cabinet that you want to share with our listeners?
The last thing I would share is that I shared how we got started as a company and talked to as many customers as possible to understand like what they want, and that's very much informed our products to date. But I would share that we're a work in progress as a company, just as humans are. And I think what that means for me is that anyone who's listening and has ideas around products, services, things that we can offer that they've seen as their own pain point in the world of over-the-counter medicine, I'm open ears. We have this amazing opportunity to build on a supply chain that's been in the market for 55 years and build a more modern experience on top of that. And I think that gives us a great responsibility and a tremendous opportunity. But doing that in a way that's sensible ultimately comes from the patient, the consumer voice, and understanding what are problems for listeners. If getting your medicine in compostable packaging doesn't matter to you, I want to hear that too. And I'd love to know, what does, and what are ways that we can make Cabinet a no-brainer for everyone. We talked a little bit about the quality audience, the sustainability audience. There's even a design audience of just wanting to have a nicer looking medicine cabinet. But for us to really be successful, I want you to think of Cabinet as like the absolute no-brainer, logical choice, no matter who you are, what your budget is, what you're aspiring to get from your medicine company, if anything. And so my ask is, if there are listeners out there who have thoughts on that or critiques, reach out to me. My email is achal@wearecabinet.com. And excited to hear from you.
Totally love it. Yeah, I'll for sure link that in there. I mean, looking through the web page already, I was like, oh, I love this sleep kit, because my girlfriend always has one when we travel, and she always brings me all the little things, the peppermint oil and the eye mask. But I'm like, I know you need
the giant Valium.
No, there's no Valium. But I'm like, you need some earplugs in there, and you need to partner with Zipa because Tim uses the Zipa product, and it makes my sleep experience so much better. So I was looking on there, I'm like, oh yeah, they should add this and that. It could turn into like a big box of goodies for sleep. So I really like that you're open to ideas and suggestions from consumers, because I looked at it from my point of view as even just a physician and a consumer, and I'm like, oh, it'd be fun to have this in there and that in there, and I'm all about innovative stuff like that too. So I love it that you're open to that, and I'm sure the listeners will love it too. I know our daughter and her generation are going to eat this up. It's wonderful. I know that friends and the listeners will as well. So I'm super excited that we got to meet you and share this and get it out to the listeners. So wonderful hearing about it. I mean, this is the way of, I think, healthcare delivery for the future, and really like to see startup like this going. So thanks so much for your time. And it's been great chatting with you and getting to know all about this Cabinet experience.
Thanks for having me. The pleasure's been mine.
Wow, that was really informative. I mean, it's, it's really interesting to listen to entrepreneurs, people willing to take their passion and, put their money where their mouth is. And I've been arguing for, honestly don't know how long, that, healthcare is really going to be changed from the outside, not the inside. I think the inside is just way, way too plugged up with, bureaucracy, with physicians doing things in a certain way, with, regulators telling us what to do, with insurance companies, pounding the metrics and all of this kind of stuff, that I think it's going to take innovation from the outside, from people really thinking outside the box and not being in the box to make that happen. And I think, Cabinet is an example, a small example of a different way to do something that we do hundreds of billions of times a year, which is take over-the-counter medications. So that was great, really informative.
And what I liked is that he's actually, touching your hard side and getting you to soften up with regards to sustainability and being environmentally responsible. And, even though you could really care less about recycling sometimes, truth be told, as we do in this show, Tim hates recycling. So I tend to do it. And, here's a way to actually help the environment so you can continue to enjoy your clean lake when you go water skiing instead of crap floating in it.
Hey, I have a car that gets at least 8 miles to the gallon.
Yeah. So that interview was amazing. Like I said, really kind of a fun part of the side of medicine. Obviously, medications is a big part of the medicine world, but something really new and innovative that we thought you would be interested in. I'm going to link everything in the show notes as far as where you can go to find them, obviously, on their website, down to how you can support them on Republic if you want to be involved, or if you want to have any suggestions on their packaging, to products, to trying them out. So before we end, just a quick reminder about our sponsor today, which is Vive Funds. Vive provides unique, passive, multifamily investment opportunities that they vet and bring to you as an investor. Reach out to Vina Jetty to see how partnering with Vive can help you reach your real estate investment goals at drpodcastnetwork.com/Vive Funds.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.